KIRO, Seattle.
This is COVID-19 Seattle. I'm Dave Ross.
And I'm Aaron Grinnell.
Governor Inslee calls on manufacturers to get busy.
Rather urgently need to increase the stocks of particularly personal protection equipment.
More on the state's needs for masks, gloves, and other medical supplies.
Redefining essential. The governor gives new guidance on who is still allowed to go to work.
One of the region's first field hospitals is almost ready to start taking patients. We'll get an inside look.
Plus, the state races to add more test kits, including at-home nose swabs.
Stay right here.
Governor Jay Inslee is asking any business that can to start making medical supplies.
In this effort, we know that the needs are great for face shields, for gowns, for N95 masks and surgical masks.
He said that the federal response thus far has been inadequate, and it'll be up to the states to meet the needs. And Dave, he called this a decisive moment.
It sounds like then the governor's perception of federal policy is that each state has to be left up to its own devices to get these supplies. He says they have ongoing orders out to the federal government, but it has not been able to supply them fast enough, and so we have to seize our own destiny, and thus he decided to plead with manufacturers to help out.
So I'm here today to ask all business people, all leaders, all skilled workers, ask themselves if they can change what you're making now. If you're making plastic parts of any nature today, we ask that you ask yourself if you could help make face shields or even the top piece that goes around your forehead.
And the governor said he called on the president, we know this, to engage the Defense Production Act. He wanted to require manufacturers to build these kinds of products. The president did require some companies to build things like ventilators, but they are not required right now to build things like masks, gowns, swab tests, face shields.
There has been pressure from some governors for the federal government to take a leadership role here. As far as you know, Aaron, has Jay Inslee just come out and said, look, why doesn't the federal government take this over so there can at least be some organization to this?
I don't think he said that so directly, but I think based on what we've heard the president say in terms of calling Jay Inslee a complainer, I think it's one of the words he used, I think he has certainly reached out to the president directly and said that, yeah, you need to make more of an effort to build up the supply chain.
The other problem is a potential shortage of healthcare workers in cities like New York, which are experiencing a much more intense strain on their healthcare system than we are. And Governor Cuomo yesterday was making a plea for healthcare workers from other states which have not reached their peak yet to come to New York and help out, get training, and then New York would return the favor by sending healthcare workers to those states when they reach their peak. But that would require, it seems to me, some kind of central organization, which so far as I can see, hasn't been coming.
Right, and here's also why this is so important right now. There's actually a story out today from the Washington Post. It says that the national stockpile of personal protective equipment is nearly depleted. So we're almost completely out of things like masks and like gowns. There was also a report in the Seattle Times last week that I read. At one point in mid-March, the Emergency Operations Center out there in Camp Murray, it had something like 550 requests from around the states. It was only able to fill something like 50 of those orders. So only something like 10% of the orders coming in from across the state we were able to fill. There is a serious need and a serious gap in supplies that are needed right now.
And as an example of some of the improvising they've had to do, Outdoor Research, for example, is converting its manufacturing facility in Seattle to make protective masks for frontline medical workers. The distilleries and wineries are able to make hand sanitizer, I guess because they have a supply of alcohol on hand. And the Mukilteo manufacturer is actually making face masks for local hospitals.
Governor Inslee has updated his Stay Home, Stay Healthy order, clarifying what businesses the state still considers essential. So, Dave, let us run down the list here. The first section focuses on the automotive sector. It says car repair shops are indeed essential, but it does now note that only a minimum number of workers should be there, and they should all practice proper social distancing.
For dealerships, you can still buy a new car or sign a lease only if you're closing a deal that began before the governor signed the order, or if you need to replace a damaged or totaled vehicle. There are also some new guidelines for food and agriculture. The governor says workers supporting geoduck facilities are deemed essential, as are commercial fishermen. Recreational fishing, however, is not considered essential.
A couple more exceptions on the list here. Nannies, they are still allowed to provide in-home care only if they are supporting children of essential workers. And private campgrounds, they are also okay, just to ensure that long-term residents are not replaced.
Most retail stores are also okay to open for business. That includes tobacco and vapor shops, as long as they sell food. And lastly, you can stow away your 9-iron because golf, absolutely not essential. Could a clothing store open up if they serve subs?
That's a good question. I think so. I mean, if you're serving food, it sounds like you're allowed to stay open.
I guess we'll have to see if they use that loophole.
Yeah.
On the testing now, there's been a lot of confusion about whether these thousands of tests that we're told are going to be available are in fact available. Mayor Durkin was on C-SPAN saying we can't get the tests, even though we keep hearing about them. Let's go to KIRO Radio's Hanna Scott. Hannah, what have you been able to find out about that?
So I was on a call yesterday with our state health officer, Dr. Kathy Lofi, and basically what she says is there's a lot of exciting things coming with testing, and I want to touch on a couple of things. The supplies, one of the things the governor had said earlier in the week was we're having an issue with a shortage of testing capability because of some of the components that are needed, the way you have to transport the vials, what you have to keep them in for that, and then also the swabs. So Dr. Kathy Lofi says actually the FDA just changed some of the rules so you can use some different swabs and some different mechanisms for when you have to transport the vials. So that's going to really ease things up. She pointed to two kinds of testing. One is something called point of care. It's something that they do at the hospital level, that instead of having to go through various labs, they can do it right there at the facility in the hospital. That's going to ramp up testing, and that's already in the works, ready to be online any moment now. And then also the at-home testing, which the FDA has not approved yet, but the idea here is if you're sick and you've got symptoms at home, you can ask for a test to be sent to you. It comes to you, you do the swab, and you send it back in. And she said they're not only just waiting for the FDA approval, but looking here at the state level at how they might be able to use that to ramp testing up right away, too. In the meantime, testing is ramping up significantly across the state. That's why we've seen from maybe a couple of hundred of new cases a day up to more like 600, 500, 600 new cases a day being reported. And I want to stress that number is going to continue to go up, especially because we've got a hold on the state numbers coming out because of the system being overwhelmed by all the negative test results. Yeah. So in a day or so here, they're going to fix that, and we're going to be overwhelmed with a massive increase of 4 days of new numbers. So don't panic when you hear that.
Good. So we should have a much better handle then on how far the spread has gone once we get those numbers, right?
Absolutely. Literally every day, the testing capability is improving.
Among the myriad responses to our outbreak is building field hospitals in case our healthcare system gets overwhelmed with COVID-19 patients. KIRO Radio's Chris Sullivan got a first-hand look at one of these pop-up clinics built on a soccer field in Shoreline. Sully described for us what it looks like there.
Well, Aaron, this thing kind of looks like what you would see as like a hospitality tent at a giant sporting event. Think U.S. Open at Chambers Bay a few years back. One of those big white exterior-looking tents that you would normally have people inside hanging out having fun. There's, big exhaust ports on the side to make sure it has proper ventilation. Then once you get inside, though, it looks like basically kind of a triage center inside. There are individual compartments set aside, some that are open air that are primarily for people that are recovering. I mean, they're kind of stark. There's a cot, some sheets and bedding, a locked footlocker that they can use for valuables. And then in the center, there's what they call their exam rooms, which are hard-walled, which provide a little bit more privacy. And so this is what they're calling an assessment and recovery center. So it's kind kind of where they can bring people that don't necessarily need hospital urgent care, but maybe waiting testing results or may have tested positive, and they can come here and they can assess what they need to do with them. And if they do have COVID-19, they can sit here and recover until they're ready to leave healthy.
What kind of medical gear do they have available at this tent?
Well, they'll have just about everything they would at, say, kind of a doctor's office, not necessarily all the way up to full hospital care. They're going to be doctors and nurses here. And the interesting thing about this, Aaron, is they also have behavioral health people here on staff as well, because, the one thing, even people who don't have COVID-19, we've all experienced it personally. The anxiety level out there is something that's real, so they'll have the ability to treat people for that. Or if they have underlying health issues from say behavioral health or opioid issues, they'll be able to handle that as well. So they've handled that particular part, not just the virus response.
How many beds are inside, and when will they become available?
We're not exactly sure when they're going to be able to stand this thing up entirely. They're still putting the finishing touches on the second building right now. A total of 140 beds total between these two buildings. They're kind of waiting for what everyone is talking about, the upcoming wave that's going to hit our hospitals. And this is really designed to be a place where people who don't need that emergent, delicate hospital care can come, so we can free up those hospital beds for the sickest of our community and give them the specific help that they need.
We will be back tomorrow and every day after with a 10-minute rundown of the daily local news. You can subscribe to this podcast. You can also find our news coverage on mynorthwest.com or listen live at 97.3 FM.